Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Dr. Ruiz.
Hello everyone, super excited about my guest today. My guest today is Misty Williams. Misty Williams spent years struggling to reclaim her health and vitality after surgery to remove an ovarian cyst. Life-threatening complications and an endometriosis diagnosis sent her into a brain fog and fatigue tailspin. At 35 years old, Misty embarked on the fight for her health and vitality, enduring many more challenges on her road to healing, including an unexplained 45-pound weight gain, fatigue, hypothyroidism, and premature ovarian failure. She founded HealingRosie.com to provide women with the resources and community to successfully confront the unexpected chronic health issues that are often experienced by high-performing women as they age. We had a super amazing interview, and you can look for the link to be invited to this amazing summit that she has put together to help women with health issues. I hope you enjoy the show. Hello everyone, super excited to have my friend Misty Williams on the show today. And Misty has such an awesome message and, just a wealth of information. This is really exciting because she is about to launch something really special here in the coming days. And I said, you know what, Misty, we need to record because I want everyone to know about this program. Misty, how are you?
I'm fantastic. How are you?
I'm just excited because just from our conversations, I know that you have a vision, a very specific vision on how to change healthcare. And I came into this health space through paleo and through paleo effects and through all of these different, series of very fortunate events that changed my life. And now as a practitioner, I get to change people's lives. But now that I'm in the trenches, I know that that's not enough. And your vision on how we can scale up the system of helping is fascinating. And I really want everyone to listen and maybe roll their eyes if they want to, if they think that this is unachievable, but at least listen because the ideas are fantastic. But before we start, in true 3030 Health fashion, Misty, what is your hero's journey?
My hero's journey. I think we get more than one in this lifetime.
And that's the truth. So I used to say, what's your hero story? As in if it's ended, but it's not, it's continuous and it changes, so what brought you into this health space?
Yeah, well, my call to adventure, we will say, my call to adventure happened in 2011, February 2011. I went into surgery because they had found an endometriosis cyst on my left ovary. And it was very large. It was bigger than a cantaloupe. And they said it needed to be removed. So this came on the tail end of me going to my doctor saying, hey, I'm 35. I want you to check my fertility. Personally, I was thinking about becoming a mother. I was single at the time and didn't know if Mr. Right was going to come along. But I really felt strongly that motherhood was something that I wanted to experience in this lifetime. And I had never had my fertility checked. So it was a relatively benign question. I didn't expect there to be anything major, but they found this cyst. And so I went in and had surgery. And the 25-minute surgery lasted over 2 hours. Once they were in there, they spent a couple hours removing scar tissue from my abdomen because I had severe endometriosis. They also removed 3 polyps from my uterus. They took my left ovary out with the cyst because it was mangled pretty badly. And while they were coming out, they stitched up my small intestine in the incision and sent me home. It was an outpatient procedure, sent me home with a sheet that said, if you experience any of these symptoms, here's what you do. And a few of them, if you experience these symptoms, you go to the ER. Great. So I went home. First 24 hours were fantastic. I felt like, wow, that was pretty uneventful. And then it was midnight on Friday going into Saturday. I remember these details like it was yesterday. and I started vomiting. And I vomited and vomited and vomited and vomited and vomited for the next 48 hours. I just would not stop throwing up. And throwing up wasn't on my sheet. There was nothing on the sheet about vomiting. And so I was kind of disturbed by this, like I'm doing something that's not on the sheet. Like, I had no instruction. I had no direction. So we were calling the doctor's office, left a message. We called around noon on Saturday. They have like the emergency number, no one was manning the line. We got a phone call that night from a doctor on duty who had no idea who I was, what kind of procedure I'd had, who my doctor was, and he knew nothing about the case. He spoke with my roommate, who was an RN, taking care of me, getting better, and he said, once she told him what was going on, he said, well, if she gets dehydrated, take her to the ER. Otherwise, you guys have a doctor's appointment on Monday. You can talk to the doctor on Monday. So I tough it out, and it was awful. Like I was so parched by this point that I could not even take a drink of water, like a sip. I would vomit a sip of water. My entire abdomen was bloated. Everything, my body was just uncomfortable. Everything was swelling in my abdomen. And I was feeling this pressure. It was like someone would blown up a balloon inside of me and it pushed the walls of my stomach all the way around to my back out as far as it could go. It was completely uncomfortable. Monday, my appointment was at 4:00. 4:35 or so, I called the office because I hadn't heard from my doctor, who was supposed to call me. And they said she'd gone home sick that day. And I asked them at the time, did anyone get my messages? Because I had left all these messages over the weekend for her. Did she get my messages? No one had called me back that day to find out what was going on with me. She'd gone home sick. I was like, can someone else help me? Of course, from their perspective, it was like the patient care was completely not considered at all in this entire process. So no one was even interested in helping me. I felt like a nuisance for asking. So she's not coming until tomorrow. So the next day I was like, I'd had enough. I mean, this is like going on 6 days of not being able to keep any food or drink down and not getting any help from my doctor after all the messages I'd left. So I went at 9 a.m. Their office opened at 9 a.m. and I walked in and I said, I'm here to see Ruth Makis. Yes, we know that you'd like to see her. She's not going to be in until 12:30 that day, I believe. Why don't you come back then? No, I'm not leaving. I am going to sit here and I will wait for her. And about an hour later, maybe it was not quite an hour, the receptionist called me over. We have her on the line. Hello, Dr. Makis. Yes, it's Misty Williams. She said, tell me what's happening. I told her what was happening. She said, okay, I want you to go to the Baptist Hospital ER right now. I'm calling ahead. They're going to be ready for you. So went to the hospital ER. They ended up doing an MRI and saw that my small intestine had been stitched up, and that's why I was vomiting. He came back and he was like, we're going to have to do surgery again. And I was like, no more surgery. But they did. They had to do it again. Obviously, I didn't have a choice. This time they admitted me to the hospital, and they kept me there for 3 days while I recovered from the surgery. My bowels woke up. We made sure everything was working properly. Part of my protocol during that cycle of treatment was they gave me Ambien to make sure that I slept at night. Now, I hadn't been having sleep issues, but it was kind of just in case, I just want to make sure that you're going to sleep well through the night. So they gave me Ambien. I think I took Ambien for one night. It may have been 2. I don't remember. I went home from the hospital, and for the next 6 nights, I did not sleep a wink. I was awake for 6 full days and nights straight. And I don't know if you've ever been through anything like that, or if you have patients that have been through anything like that.
I have patients that have been through it, and they say, I would not wish this on my worst enemy.
It is, I thought I was losing my mind. I was so utterly exhausted by day 2. Like, I was like, please, God, I want sleep. Please, I want to sleep. And I would lay there all night, and the clock ticks so slow in a situation like that, begging sleep to come, and no sleep would come. And I would get up and have to face a whole nother day I had client work I was supposed to be doing. I had responsibilities, and I would get through it as best I could, not functioning at all. My body has not had a reset, and I would go to bed the next night begging God for sleep. It was torturous. It is, I just can't, I had no idea that was even a thing, that people would go days like that without sleeping. I felt completely powerless. I was overwhelmed and exhausted and super emotional. I mean, by the fourth day, I am just like, everything is making me bawl, and I can't handle anything in life at that point. But my system was so stressed, by everything that had happened to me, that I was so dysregulated, because of all of the stress that I endured in between the first and second surgery, and then of course another surgery itself. Plus, on top of that, I don't think the Ambien helped. I think it probably made it worse. It was total crisis. So imagine, how the body works. Imagine all these stressors that I've already been through are enough for the body, but then going 6 days without a reset, like 6 days of no sleep. And I think the most you can go before it kills you is like 10,
10,
or something.
10 days, yeah.
Yeah.
I ask my patients, what is your favorite thing in the whole wide world? Misty, what is your favorite thing in the whole wide world?
Sleep.
Exactly, because it's usually like, oh, chocolate. And then I go, well, can you do 30 days without chocolate? And they're like, oh, sure, I'll do 30 days without chocolate. Okay, you can only do 12 days without sleep. Your favorite thing is sleep, and that's it, you will die.
Let me tell you, I had a whole different relationship to sleep after that experience, for sure. But, on the other side of all that, so I didn't go in with symptoms. I didn't have hormone symptoms before the surgery. I didn't have a lot of things going on, that would indicate that I had any problems. I mean, my checkup, everything was totally routine. Like, nothing was presenting that made me feel concerned about my health. So I went from being perfectly healthy to having this experience, and on the other side of it, being wrecked. I had brain fog. Like, it felt like there was cotton stuffed in my brain, and I was trying to think thoughts, and it's like I could feel the thoughts trying to get through my brain, but it's like they had weight tied to the back of them, and they could not make momentum, So I had this terrible brain fog. I was so emotional, and it's not really my personality, other than being a really passionate person, which I'm definitely passionate, but it's not my personality to be really emotional. Like, I'm not typically like really easily triggered. I'm not typically a major crier, like something happens and I'm just like bawling. I'm not typically feeling like I'm on the edge of a breakdown at all times, So that was really, really different for me. So I had this terrible brain fog, and I'm super emotional, and I felt like my body hadn't bounced back from the surgery. I was carrying all this extra bloat and inflammation, after everything that I had been through. My energy was tanked. Oh my gosh, my energy was absolutely tanked. And 2 weeks after I was sent home, I went back to the doctor. And at that time, she told me that I had endometriosis. She told me that they had removed the cyst. They also had removed my left ovary, that they had removed the polyps, the scar tissue, you have endometriosis. And I was like, oh, okay. This was the first time that I knew that they had done so much. Okay, you've diagnosed me with the disease, endometriosis. Can you tell me, like, what causes endometriosis? What kind of lifestyle changes do I need to make to account for the fact that I have got this disease? And she said, we don't really know what causes it. You can Google it. We can put you on birth control, or I can do surgery again if it comes back.
So you go in for a checkup to do some preventative measures. You leave without an ovary and with the diagnosis. I think the question would be, did you Google it?
Of course.
And then for my listeners, what is endometriosis?
So I actually have a whole talk on endometriosis, for flabby, foggy, and fatigue, the fix for female hormones. And I know we're going to talk about that a little bit later on, because this is a big question. And the truth is about endometriosis, there's not a whole lot that's known definitively about endometriosis. Things that I started learning when I started studying about endometriosis is that endometriosis typically is tied to an upside down PGE2 ratio, meaning that your estrogen is very, very dominant in that progesterone estrogen ratio. You've got too much estrogen in the system and or not enough progesterone in the system, and it's creating a lot of dysfunction and disease. My endometriosis included, I had symptoms of endometriosis since I started my period, really, but I didn't know it. So I had super heavy periods. My periods would go for 7 full days. The first 4 days were unbelievably heavy. I would routinely fill up in those first few days a Super Plus tampon in 2 hours. That's how heavy my bleeding was. I had terrible cramps. I would pop 3 to 4 ibuprofen every 3 to 4 hours for the first 4 days of my period. My cramps were intense. I would sleep with a heating pad. I remember with my girlfriends, we would compare notes. Like as teenagers, especially, I remember doing this in college a lot too, about how I'm cramping. My cramps are so bad. It's that time of the month. Aunt Flo is here, and we would kind of commiserate around our symptoms. I did not know that actually that's abnormal. That if you're healthy and you've got good healthy hormone function, you rarely will experience those kinds of symptoms. I had no idea. I just thought this was normal, and I had girlfriends where this was normal for them. Society told us it was normal. What was pumped to us is, your period comes and so you need Midol. And so they built this whole brand around helping women who are experiencing these very normal symptoms, So I didn't know any different. And of course I had no idea that these symptoms were tied to endometriosis.
And physiologically speaking, what happens is that your estrogen kind of proliferates or makes the endometrium, which is the lining of the uterus, grow. So if you have estrogen dominance, now you're going to have more growth of the endometrium, and that endometrium can grow up through the fallopian tubes and outside, and it can encapsulate your ovaries. And so now you have endometrial tissue outside of your uterus, So then when the progesterone...
And it's swelling every month. Your period.
Any time the progesterone, kicks in, it's going to shed. And if it has nowhere to go, it starts accumulating. And because it's accumulating, it creates cysts and scars, and it's pretty awful.
Yeah, she spent 2 hours. It was coating my organs. All of my bowels and intestines were covered in endometrial tissue. Of course, it had completely mangled one of my ovaries to the point that they felt like they had to take it out. I really wish at that time that I knew about things like systemic enzymes. I don't know how familiar you are with systemic enzymes.
Like enzymes and things like that?
Yes. I use Vitalzyme, or the ones that I take. But I would love to have given things like that a shot. I wish I would have known that systemic enzymes, there are cases where it has actually helped to dissolve and clear away all that extra tissue. What might have been as far as my own fertility and being able to keep that ovary if I had been able to avail myself of things like systemic enzymes. And that's one of those things that we don't have a whole lot of science on, except for in general understanding, the role of fibrin in the body and fibrin buildup, and systemic enzymes seem to have a role in dissolving excess fibrin buildup, and a few different things like that. So I think we're kind of connecting dots here and just trying to figure it out. But as far as like actual studies involving systemic enzymes, I'm not aware of any that exist that would be considered scientific studies. But so much of this, for women in general, so much of what ails us has not been given the scientific dollars in general that I'm one of hundreds, maybe thousands of women who are trying to read the tea leaves and figure out a healing path that's going to work for them. Because for the most part, certainly in my case, mainstream medicine relegated my disease to being not important enough to study and to cure.
And you were doing everything right. You were going to your doctor to make sure you were able to be fertile, so you were
and everything right. We could put that in quotes, it's like what I knew to do, what conventional wisdom is to do everything right. Certainly I ate healthy in the way that I thought eating healthy was. I was running half marathons. feeling like this is a really healthy thing that I'm doing for my body, not realizing that I'm creating running half marathons for me is adding a lot of stress to a system that I have since learned was experiencing a ton of stress. And really, if it weren't for the surgery and the complications after the surgery, I may not ever have been given this call to adventure. I mean, if my path would have unfolded a little bit differently, I wouldn't have come face to face with all these challenges and had to face my own mortality. And I don't mean mortality in the death sense. I mean mortality in the dying sense. Like, I'm 35 and I'm starting to lose my health. It's getting away from me. If these things hadn't happened, I would have had a very different life than the one that's unfolded before me. But that definitely, when you ask about call to adventure, that was definitely mine. Walking out of my doctor's office with this diagnosis, knowing that I was not going to get help from her. And then I found out as the story unfolded for me, I went to my primary care practitioner, doctor, who's a nurse practitioner, talked to her about what I had experienced, told her I wanted lab work. Let's figure out what's going on in my body. And I started hearing the story that so many women hear that find themselves in this situation. And that story is, your labs are normal. Everything is normal. Everything's fine. And I'm just like, what are you talking about? These are all the symptoms that I'm experiencing, which, she had seen me previously and I wasn't presenting with any of these symptoms. And now all of a sudden I have symptoms and she's treating me like that. Like I'm a crazy person, like I'm making it up. Or I've lost my rockers somewhere, or, I'm just losing my mind. But my labs were normal. Everything's fine. And I, like, at that point, there was something inside of me. It's like I started hearing the drum beats, we are going to war. So yeah, I everything in my life changed at that point in my journey.
And we do put, as a doctor, we are put on a pedestal, and you don't know how many times I answer with, I don't know, but I will help you figure it out, and it's and like sometimes, you would think that saying I don't know would be like bad or detrimental. But when I say I don't know, you can see the patient's face like light up, and they're like, whoa, it's like because I don't have all of the answers, and we are organic organisms that will react in different ways to different medications, and will react in different ways to different foods, and will react in different ways to different lifestyle changes. And I acknowledge that I don't know everything, and that I am there not as like a dictator, but I'm there to help you figure things out. The opposite, or the other side of the coin would be, yeah, that doesn't matter. Yeah, that's not important. Yeah, that's not, and to them that sounds, oh, you're crazy. What you're experiencing, it doesn't matter. And either I'm crazy or I'm just this rare case that no one will be able to figure out.
Yeah. There's things that I began learning pretty early on in my journey. And I think this is something that I would really love to share with all of your listeners, particularly women and the men who love them. I found out really quickly in my own journey that I needed to reduce my expectation of doctors. My expectation going in was that whatever goes wrong with me, I'll sit down with the doctor. I'll be a very willing patient, and they'll tell me what to do, and it'll be done, and I'll go home and all will be well. That was not my experience. I subsequently, within the next 6 months, I continued to advocate, wanting to get labs and everything else. I was referred to an endocrinologist finally, after months of asking for a referral, to find out more. I wanted to find out what was going on with my hormones. Who I sat in her office. She had all my lab work. She knew my entire history. I sat in her office, told her what I'd been experiencing, that I was concerned something more was going on, and I felt like we needed to get to the bottom of it so that I could mitigate what was happening. And she basically said, well, I've reviewed your lab work. Everything does look normal. I will run some additional labs for you. Thank you very much. And while you're here, she came over and she started feeling around on my neck. touch with her fingertips, just touching around my neck. She goes, I want to take you to the back and let's do an ultrasound. I think you might have something going on with your thyroid. So she took me to the back, did the ultrasound, and sure enough, I had nodules growing on my thyroid. I'm like freaking out because it's been 6 months. There was this cyst that I didn't know existed. Now there's these nodules that I didn't know existed. I'm feeling like my body is mutating. What is happening to me? And what she said to me was the same thing that I heard from the other doctor. We don't know what causes thyroid nodules. I'm going to biopsy this. We're going to make sure it's not cancer, and I'm going to refer you to a surgeon so that you can consider having your thyroid removed. And I just was like floored. So she runs lab.
This happened back in 1796. Because
right, you would think
because
was 2011. Yes, this was 2011. By this, I did have a birthday, so now I'm 36. But yeah, she found these thyroid nodules and ran some labs. All my lab work came back. She said it was all normal, that everything looked fine, and talked to the surgeon, which I did talk to the surgeon just to explore my options, but completely did not want to do another surgery again. He didn't have any answers either as to what caused thyroid nodules. And I just, like, at this point, I'd been on this journey for like 8 or 9 months. I had stumbled across a doctor in the ancestral health space who was blogging about a lot of the things that I was experiencing in my own body, a lot of the symptoms. And I started little by little learning from him about some of the basics. I learned from him, for example, that estrogen dominance was a thing, right? And I started learning about common treatment protocols that are used for women that had hormone issues, which I knew I had hormone issues. I thought what I needed was bioidentical hormone replacement to help me with my hormone issues. And I've since learned tons more. And we could sit here and talk about this stuff for 5 hours. But bottom line is that my number one lesson in learning how to advocate for myself is I needed to reduce my expectation of doctors. The second thing I learned is that when it comes to our lab work, mainstream medical doctors have lab ranges that are basically based on the entire population, and they're really disease ranges. If your numbers fall outside of this range, then we can confirm that you basically are in a pretty advanced disease state, right? However, what they don't work with typically, and this is why functional medicine is so important if we want true healing, is they don't tell you what the optimal range is. Meaning, if you want to be healthy and you want optimal health, you need to understand what those numbers would look like if you were a relatively healthy person without a lot of inflammation and stuff going on in your body that was pushing you toward a disease state. So that's another thing that I learned pretty quickly in my journey that was revolutionary, is this idea that there's optimal lab ranges. And for me, because I was not getting any support from doctors, I felt like I need to know this for myself. I need to have an idea of what this looks like for myself. I remember the first time I went and had all my labs done. Like, I got a list of all the labs you should have ran in order to optimize. And I remember running those labs and being like, yeah, I got my labs, and looking at them going, I don't know what to do with these. And my doctors didn't either, by the way, at the time.
Because they're within the range. They're normal.
Right.
You're crazy. Here's your Prozac.
Yes, Misty, we know that I've had a couple of times since then in my journey where I've really struggled with weight gain. And it was I was working out with a trainer. I was full on paleo. I had been gluten-free for a couple of years by this time. And it was like, we know you're eating cookies in the closet. We know what's really going on here. Just don't eat so much crap and you won't. And like, it's infuriating. As a woman, I'm feeling like this is not because of my diet. Like, I know that I did not gain this 45 pounds in 4 months because of my diet. I'm eating like grass-fed meat and vegetables and like no processed food, no sugar, nothing. Maddening. So that the next thing that I learned was around lab work. I need to understand the basics. Okay. This does not make me a doctor. It doesn't mean I'm practicing medicine or trying to pretend like I'm a doctor. This is my way of engaging with my own health journey. I want to know what's going on in my body. So one of the opt-in gifts actually that we're offering to every woman who signs up for the Fix Female Hormones is a labs tracker that includes the labs you should be running, the optimal values, what it means if it's low, what it means if it's high, so that women can start to get an understanding of what's going on in their own bodies. What does it mean when my T3 is 2.2? Is that low? Is that high? Is it normal? Is it completely in range? I don't know. Like, as a woman, you don't know. But if as a woman you look at it and you're like, oh my God, I see that my T3 is 2.2. Optimal ranges are going to vary from practitioner to practitioner, but let me just kind of throw out, for the purpose of this conversation, 3.0 to 3.5, right? That means I'm low. I really should try to find someone that can help me with that.
Yeah, and you have to take into consideration, okay, so your T3 is at a certain point. Where's your T4? What's the ratio between T4 and T3?
Exactly. Do you have what's your reverse T3? Of course, it's a whole bigger conversation. But the point of this part is understanding what labs you need to run, and engaging yourself with your own numbers is going to make you a much more powerful advocate for your own health. It's going to help you to be proactive in the ways that you need to be proactive in working with your doctor to really reverse what's going on in your body. To expect that you're just going to have a doctor that takes on all of your health goals is just completely unrealistic. I mean, I know some amazing doctors in our space. I mean, the best in the world are in the ancestral health, functional medicine space. And they do not have the bandwidth, even if the heart is willing, to take on a patient's entire journey to getting well. There are so many facets and components to it. It's not realistic. So if you're serious about being well, you have to step up to the plate, and you have to answer your own call to adventure in this area. You've got to take on the charge yourself of being an informed and educated patient, so you can advocate for yourself and also have some internal leverage. For me, at different points in my journey, my lifestyle choices have been powerfully motivated by what is in my labs. I have so much leverage on myself to make certain changes because I know what my lab numbers are and I know what they mean. I watch my mom, for example, going into the doctor. She'll get her labs run. Her engagement with that process is the doctor says everything's normal, and she says, okay, bye-bye. And she goes home. There's nothing that came up in that lab work that's inspiring her in the least bit around the lifestyle choices she's making every day.
Back to the reference range versus the optimal ranges. There are reference ranges for a lot of things: micronutrients, your thyroid levels, metal toxicity, all of these things. In spoiler alert, we do know what causes thyroid nodules. It's not a secret,
right?
Yeah, it's not a secret.
We can totally talk about that too, because I'm on that journey. I actually discovered what caused thyroid nodules in voracious research, even though, like, my journey, and I'll let you explain it, but my journey, even after I found out what caused them, finding a doctor who would properly run the tests to be able to diagnose whether or not I had this thing was a nightmare. And it did not happen for me until last year. So last year's 2017, I'd been on my journey for 6 years. I personally didn't even know. If I would have known the test to run, I would have had them run myself. I knew 2 of the 4, but why don't you explain what causes thyroid nodules?
So I have a whole hour on the topic on one of my podcasts, podcast 40 something, and I talk about autoimmune thyroid. And the autoimmune thyroid is, your immune system attacking your thyroid and creating an attack and eating away at your thyroid. And then by eating away at your thyroid is trying to defend itself, and it creates cysts and nodules. And then some of the things that I didn't cover in that hour is that the reason your thyroid is getting this attack and your thyroid gets bigger, because you know that if you have hypothyroidism, you develop a goiter. Your thyroid grows, and the reason why it's growing, it's because your thyroid is basically an iodine concentrator. So it's trying to get all of the iodine and concentrate it to make thyroid hormone. And the way the thyroid functions is that there's a signal from your brain to your thyroid called the thyroid stimulating hormone. And if your body notices that you don't have enough thyroid hormone circulating in your body, the TSH, that signal, gets louder. And that's how your brain is telling your thyroid, make more thyroid. But it also, TSH is actually a growth factor for your thyroid. And if you are growing that thyroid while it's being attacked, you're going to create those nodules. So you have a 1-2 punch. You have the autoimmune attack on your thyroid. So you have, immunoglobulins binding to it and attacking it and irritating it. And then second, the TSH, your body doesn't know how to create more thyroid hormone. It's screaming at your thyroid. And the TSH in itself, it's a growth factor for your thyroid. So while you're being attacked, you're also developing a bigger thyroid. This is the reason why there is an optimal range for your thyroid. And that optimal range is somewhere between 0.5 and 1 for your TSH. Because at that point, you're not getting palpitations, you're not getting osteopenia, osteoporosis, you're not losing cardiac tissue. And at the same time, it's low enough where that TSH is not acting as a growth factor. So you're getting enough signal from your brain to your thyroid to continue having normal physiological processes without having enough TSH to do that second punch, which is the growth factor of your thyroid. But that's not creating the nodules. There is an autoimmune attack, and we have to investigate what is creating that autoimmune attack. And there's so many different things that can cause autoimmune disease. For example, you can be inhaling too much pollen. You could be eating gluten. You could have endocrine disruptors. You could have, there are so many ways of hijacking your immune system to create this autoimmune attack. So yeah, that's a completely whole different conversation. So it's no secret that we know how nodules are created. It's and not only that, we have patients that show up to our practice with nodules, and we're able to reverse those nodules. And those nodules, after good thyroid replacement, disappear. And then they go back to the person who maybe diagnosed them with thyroid nodules, or they go back to the endocrinologist, or and they're like, yeah, no, you maybe didn't have them. and right. we have like the two reports.
We have pictures.
Yeah.
Well, what I discovered whenever I started researching this, and this is the path that I went down for myself, is that thyroid nodules are caused in part by Epstein-Barr virus. So that was actually the only thing that I could find. This is in Misty's layman's research, okay? I'm not going through med school and learning, but just with what I learned, it was Epstein-Barr.
And you're not wrong, because viruses activate the immune system.
Absolutely.
And if your immune system
plays right into what you're saying.
Correct. So again,
yeah.
so viruses, endocrine disruptors, food allergies, environmental allergies, so many different ways.
Right. So I knew the Epstein-Barr thing was something I wanted to investigate, and at the time, I actually had 2 of the 4 tests run for Epstein-Barr, and my doctor came back and said, oh, these tests just show that you had a previous infection. They don't show that you have an active infection. And I was infuriated by that because, like, at the time, I didn't know what the 4 tests were, but I just felt like, how do you know that I don't have an active infection right now? You haven't run a test to see if I have an active infection. So last year, I discovered what those 4 tests were. I had them run, and I was high for all 4. Very active Epstein-Barr. And this year I've been doing a protocol to eradicate the Epstein-Barr. That's been a whole other amazing part of my journey. But yeah, the thyroid nodules, doctor after doctor basically telling me my labs are normal, everything's fine. And they just kept finding stuff and my labs are normal, everything's fine.
And you know what? I completely missed my point because, okay, so my point A was like, yeah, we do know what causes thyroid problems. Point B is the difference between reference ranges and optimal ranges. Okay, so like TSH, if it's high, it's creating growth on your thyroid. It doesn't get to be problematic to where that TSH is beyond 4.5. That's when it can become so problematic that your thyroid is too big, that you can cause like maybe an obstruction, or your vocal cords begin to get hoarse, or like, for example, the best example that I can give you is vitamin C. Okay, if you have a bucket full of lemons on a pirate ship, maybe you won't develop scurvy. But, vitamin C is not just used. It's not an anti-scurvy agent. It's used. It's used for collagen production. It's used for detoxification. It's an antioxidant. It's a pro-oxidant. It's it's all of these different things.
All these other things.
Yeah.
Sure.
So yeah, the reference range is like the low bar to prevent an overt thing. Like we see this with thyroid antibodies. The thyroid antibodies is less than 34. That's what the reference range is. So what? If you're at 31, you won't do anything about it? You're just going to sit there looking at your watch until it gets to 34? Well, we're 33, not yet. It's nothing. You don't have Hashimoto's yet. Maybe in 6 months we can check again and see if you get, But meanwhile, there are so many things that we can do. For example, start investigating. So, do you have Epstein-Barr? Do you have endocrine disruptors? Are you allergic to any foods? So in my practice, any amount of antibodies to your thyroid, it's a trigger for me to order an ultrasound, to start investigating all of these things that could cause an autoimmune condition, and to start looking into what is the underlying cause for these antibodies to show up. I don't wait until they get to 34.
I actually had in my labs, along the lines of what you're saying, my TPO antibodies were around 9 or 10. And I remember at this point, like I was pretty new. I had found the functional / paleo / ancestral health space. And I was just like, there's a lot to learn and study. But I knew enough to know that if I have antibodies and you're not supposed to have any, even though I didn't have enough to say that I had Hashis, I was trending in the wrong direction. And I had my last bite of gluten in November of 2011. I have not touched it since. And I did a bunch of other things, too, to make some other changes in my diet and lifestyle, because I was so concerned about an autoimmune condition. And fortunately for me, I haven't gotten far enough in some of these disease paths so that I actually had a full-blown autoimmune condition, but I certainly were seeing markers that for me were just like, okay, we're going to back off.
So I'm gonna time you out on that, and I want everyone to hear this. If you have an autoimmune antibody present in your lab work, you have an autoimmune condition. It might not be
you could totally say it
totally.
That way.
Yeah, totally. It's not overt.
It's not. Maybe it's not diagnosed. It's not the diagnose. It's you haven't met the criteria where they would diagnose you with the disease, but you certainly have autoimmune issues going on.
Yeah, and I'm gonna blow your mind. You know what? You know what the gold standard diagnosis for Hashimoto's is?
What?
To take out your thyroid, to slice it up, and do cytologic evaluation. That is the standard to diagnose someone with Hashimoto's. Having no autoimmune antibodies does not rule out Hashimoto's. So even if you have zero, and this is conventional medicine, and the example that I give is like this, let's say you go hiking in the forest, okay? You're hiking in the forest, and then you're like, ouch, and then you have 2 pin marks on your ankle, and then you go to the doctor and like, hey, my ankle is swollen, I have 2 pin marks, it hurts a lot, my foot is black and blue, and then the doctor looks out the window and is like, no, I don't see any snakes, it's probably something else. No, lack of seeing snakes cannot, you cannot be sure 1,000% that wasn't a snake bite. But a good functional doctor would give you antivenom.
Right.
So these antibodies fluctuate so much day to day because of your exposure to different things. So that's why it's so important that if you have any amount of antibodies, to follow that trail. And if you're not within that perfect, TSH, start, trending your antibodies, start testing antibodies. Go ahead and get an ultrasound just to make sure you don't have nodules. Start doing all of the things to prevent an overt situation where you're going to have, cancer, or they're going to have a nodule that they're going to biopsy, and they're like, yep, you have Hashimoto's. That could have been avoided.
Yeah. Let me tie a ribbon around what we're talking about here because we're walking through the advocacy steps. So number one was I reduced my expectation of doctors. And number two was I expanded my understanding of lab work in my own labs. Number three is not, and this was hard for me at the time, but to a doctor, a health goal, when working with my doctors, I could not say, as a health goal, I want to know what caused my thyroid nodules. That's not a health goal. Now, to me, it seems perfectly logical that I want to know what caused my thyroid nodules, and I want to test till we figure it out. But from the perspective of where do you want a doctor to support your journey, that is not a health goal. And if you want to communicate and work with doctors, this is an important point. If you want to get a doctor enrolled in your journey, you definitely need to go into your relationship with some very clear goals and find out right up front if they're willing to buy in and support you and help you with your health goals. So if it's okay with you, Guillermo, I want to share what health goals are.
Oh, go for it.
So you don't have to adopt all of these health goals as your health goals. But if I were sitting down and I would say, what do I want for my mom? Okay, what do I want for someone I love? These are the kinds of things that would be on our health goal list, all right? Regular, normal, pain-free periods if a woman is not menopausal. Regular, normal, pain-free periods. That is a health goal. I wish I would have gone to my doctor and been able to present that this is an outcome that I want. Can you be committed to helping me with this outcome? Okay. No migraines or headaches. Now, I'm fortunate that this has not been, there have been times in my life where I've had seasons of lots of migraines and headaches. This hasn't been as big a deal to me as many, many women that I know. There is a woman here in Austin who has had a migraine headache literally for 3.5 years. Solid, constant migraine headache. I watch her on Facebook talking about all the therapies and the things. I mean, some things are aggressive and invasive that she is trying. Nothing's getting rid of her migraine headache. My heart goes out to her. No migraines and headaches. Migraines and headaches are not normal. I have a cousin that's dealing with migraines and headaches right now. This space is one of those where, if people want help and support, I can certainly lend it, but you can't convince someone that they should do something differently than they want to do it. So my cousin's having migraines and headaches, and it's the drugs that she's taking with these terrible side effects to try to get rid of migraines and headaches. Migraines and headaches, you don't solve it with drugs. There's something going on in the body that you need to uncover so that you don't have migraines and headaches.
And this is not to vilify or to make people that have to take a drug every once in a while to, that's completely different. That's not what Misty's saying.
And let me just tell you, in my own journey, I'm on bioidentical hormone replacement therapy. Okay. I'm 43 years old. I've been on BHRT since I was 39. Is that right? Since I was 39. Okay. At 38, it was right before I turned 39 that I actually went on bioidentical hormone replacement. Here's what I would tell you. I thank God for bioidentical hormone replacement therapy. And I also am only damming the waters with bioidentical hormone replacement therapy. I cannot rely on BHRT to permanently fix the symptoms and stuff that I'm experiencing. And in my own journey, I've actually experienced, and I don't know if we'll have time to even get into this conversation, but with BHRT, it's worked for a while. And then my symptoms start creeping back in. And that's because I haven't gone after the internal stressors that are creating this disease state in the body. And over time, it just gets worse and gets worse. It starts affecting your mitochondria at deeper levels. That powerhouse of the cell is weakened so that healing can't happen as quickly as it needs to happen in order to overtake the disease state. So BHRT, I love it. Thank God for it. It's been a lifesaver for me, but it is not the end all be all to my symptoms. In fact, doing this Epstein-Barr protocol, I'm getting really frequent periods right now. They're coming over the last 2 months. They've been every 2 to 3 weeks. And my periods, last year I had 3 periods the whole year. So they're coming faster. That's because we're creating healing in the body. Things are improving, and I'm on BHRT, so we're doing lab work right now, and we're going to have to adjust all my doses. But that's just to say, you can use medication or pills to handle a condition in the short term, but you are not healthy. It is not fixed.
Yeah, correct. Yeah, but it doesn't mean that you need to suffer through them. Go
Absolutely.
ahead.
Okay, another goal. Weight managed well with under 30% body fat. Now, there's a little bit of controversy around this. Currently, me, Misty Williams, I'm about a size 8, and I'm probably 33, 34% body fat. My cousins were just here from out of town. Misty, you look great. Why would you ever want to lose more weight? I don't really want to lose more weight for aesthetic purposes as much as I know my BMI is higher than I want it to be. So that is still a health goal for me. A health goal for me is to have a healthy BMI. Another health goal, my brain isn't foggy and forgetful. It functions well. It's sharp, focused, and I have great recall. I want to go to my doctor and say, this is important to me. My brain is fogged up. I can't think. I forget everything. You know, a thought comes in and it disappears before I can even get it out. I can't remember it. I'll sit down and I'll work so hard. I'm getting headaches because I'm trying so hard to figure things out. You know, that is a health goal, a brain that functions optimally. My energy is strong. I can get through the day with energy for kids, my partner, my household responsibilities, and work. That is a health goal. Good, strong energy. Sleep is great. I'm able to fall asleep between 9 and 10 p.m. I sleep through the night without waking, and I awaken refreshed at sunrise. After my surgery, this is the very first thing I went after was my sleep. My sleep, I didn't know it was trash, but my sleep's been trash basically my entire adult life. Starting at 18 years old when I went off to college, all through my college experience, I never went to bed before 4 a.m. Ever. 4 years. Up until 36 years old, I had not gone to bed before 2 a.m., probably hardly ever in all those years. I was not going to bed when I needed to go to bed. So what was happening is my hormones were not able to properly replenish at the time that, from a circadian perspective, my body is designed to replenish and restore my hormones and tons of other things, you know? So I had to like retrain myself to get to sleep, and it took a long time. I routinely woke up like I'd been hit by a Mack truck, like just feeling crashed, tired, like I would wake up and it was like I had to climb out of a pit of sleep and just fatigue and, you know, not knowing where I was and my brain not working. And I just thought that was normal. It's because I was waking up. I had just been sleeping. That's why I feel this way. I had no idea that you could wake up in the morning like, bing, bright-eyed, ready for the day. Like I didn't even know that was a thing. It's a thing. And being fit and strong, able to handle functional activities on par with the lifestyle you want to live. There is a range, especially in our space, of what fit and strong means. I would say, what is fit and strong for you? You know, what does it look like? You want to be able to move and walk and not get winded and be able to count on your body, you know, count on your body. Good gastric functioning with healthy regular stools and little to no tummy upset, flatulence, diarrhea, constipation, food sensitivities, etc. I haven't had major gastrointestinal issues, but so many women have major, and it's normal. Like I talk to some women and it's like they've gone through their whole lives thinking that everyone has these kinds of issues. Everyone gets food poisoning all the time. Everyone has major gas. Everyone gets crampy and has diarrhea. That's not normal. Or constipation. Yeah, and you can't go. That's like just a totally normal part. You know, once or twice a week I deal with an episode. That's just it's not normal. And finally, not that this has to end the list, but you know, here is just kind of an example of what health goals look like: a healthy libido and pain-free sex. I wish that for all of my sisters, a healthy libido and pain-free sex. Sex is so, so good for us. It's so good for our hormones. It's so good for our nervous system, you know, the serotonin and all the good things that come along with having a really healthy libido and pain-free sex. We need it in order for our bodies to be healthy, in order for us to be healthier. So these are the kinds of things that you can take to your doctor and say, here's my goal. Are you enrolled in supporting me? Will you help me figure out, here's the symptoms I'm experiencing. Here's my goal. Can you get behind me? If they are not bought in to getting behind you and supporting you, you need to find another doctor or practitioner to help you.
And none of those goals are, can you make this number on my paper go
right.
up or down?
That's right. It doesn't mean anything. And doctors really resist it. Like, it's almost like they are so busy and overloaded with so much work as it is that it kind of seems petty and it seems insignificant. Like, this patient I've got patients that have cancer and, had these major things wrong, and I'm trying to help save their lives. And you want, your number to look a certain way, or you want me to try to help you figure out why you have nodules on your thyroid that aren't really hurting you.
Or the opposite, where you have a doctor. I just went on a rant about how the perfect TSH is between 0.5 and 1. And let's say I put you at 0.5 and 1 and you still don't feel great. and now you're experiencing palpitations. Now you're experiencing headaches, and maybe you're not ready to be that suppressed, and maybe you feel better at a 2. So it can go both ways.
Yeah, totally. Another thing that I've learned too about my own lab work, here's an example of labs awry. There was a time in my journey, which I alluded to a moment ago, where I gained 45 pounds in 4 months. Now, at the time, it was a mystery. I only recently connected the dots on this. It's been a mystery. Like, I don't know why I gained all that weight, like really in this short little window of time. Not too long after that, I went on hormone therapy, was able to lose a little less than half, and then I used HCG to lose the rest, which the HCG topic is another, it's very controversial in our space, let alone getting outside of our space, But for me, like, while my weight was up, I had high triglycerides, I had high LDL cholesterol, and I had a few other markers. I have to pull my labs out now, but I had a few other markers that were abnormal. Once the weight came off, now, mind you, my diet's the same.
It was all those cookies
right,
inside in your closet.
My diet's the same. Yeah. So the reason why my LDL was probably presenting higher too is I was doing a moderate to high fat diet at the time, but that my diet wasn't to blame. What was going on with me is I had all this extra inflammation in my system because I was carrying all this weight and probably all the other dysfunction that was going on with it. I found out that the weight gain was caused by mercury. I had my mercury fillings removed and they didn't dam my mouth. And all of that mercury, when they drilled it out, went up into my brain, hypothalamus, pituitary, whatever, down into my thyroid, which has already had the nodules. I knew that nodules were there and everything. And I'm just adding insult to injury on my poor thyroid. So yeah, I gained that 45 pounds, but I could have been obsessive about my cholesterol numbers, for example. And like the things that you would do to try to fix the cholesterol numbers I didn't do anything with my diet, right? I did these other little hacks to get my, the hormones, and once the weight was off, everything normalized. So for a lot of women, like I personally am a fan of women being open-minded to more aggressive things. If you have trouble getting weight off, like if it's coming on and it's not diet and exercise related for you, there are other options and things you can do. And I know it can be scary as a woman, and especially because there's so much social programming around this for us, but there is nothing as unhealthy as carrying the weight. Almost nothing. I'll say almost, just to kind of give an out to that conversation, but almost nothing is as unhealthy as carrying all that extra weight when you already have a broken body, and then you're throwing all of that weight on top of it and trying to get well. I mean, it can literally feel like you are bailing water with big holes in the bottom of your ship,
But now, you are part of this health sphere. Why didn't you do intermittent fasting, or why didn't you do all these things that all these guy doctors are telling you to do?
Right? I tried, man. I really thought the whole fat thing, that was a big, big, big topic when I first came into the paleo space. This was back in 2011, and everyone was talking about fat and how important fat was. And of course, fat is totally important. And the guys would talk about how they would eat high fat and they would lose so much fat. And I remember feeling like, what a jiff. I'm doing all the same things they're doing, and I'm not like losing extra fat. It never worked for me like that. And I think that's just par for the course. I mean, we just see that in our space a lot, where what works for the men, and they're touting, these great biohacks and making it seem so easy, women have really mixed results from it. And what I hear, and what's really inspired me actually to want to create Healing Rosie, which is this community that I'm building to help women heal, is that the response will often be, oh, women are more complicated than men. Which is true. Our biology is much more sensitive to our environment. We're the perpetuator of the species. There's many reasons that Mother Nature has made it that way, but 70% of the ancestral health community, functional medicine / paleo / whatever else you want to throw in there, is women. 70% is women. So at some point, we have to get beyond this, oh, it's more complicated for women, and the conversation keeps moving to backing up and saying, this is more complicated for women. What are we going to tell the women? What do the women need to do?
Okay, so 70% of the people in the health space are women. What's the percentage of the presenters?
Right, way more men.
It's not 50-50.
Oh, no, not at all. Not at all. And, there's a lot of different reasons for that. But if you're a woman or a man, regardless, as a practitioner, to take time to treat women is not as lucrative. That's just the truth. It's not, you don't make as much money because it takes a lot more time and effort and energy. Women are more complicated. You're going to probably do more rounds of testing. You're going to hit more obstacles. You're going to need more interventions. I mean, it's more challenging to treat women. And part of why I am really passionate about Healing Rosie and my upcoming event, the Fix for Female Hormones, is because there is so much that we as women can do just by getting educated and coming together and comparing notes and, kind of joining in sisterhood to figure a lot of this out. There's a lot we can do together where we don't need to put all of that burden on our doctors. When I'm talking to my doctor, listen, there's so much of my lifestyle and things that I'm doing to get well. My doctor has no clue that it's even happening. I don't need my doctor to know that it's happening. I 150% own my own health. And I've learned a lot. And I don't put that on my doctor. I'm working with Ryan Freisinger here in Austin, who is brilliant when it comes to overlaying genetics with your labs, with your entire life history. Like, he had me do a timeline. It's like timeline therapy type stuff. Over my whole life, he wanted to know all the traumatic events basically that I'd experienced in my life, and the good. He wanted the highs and the lows. So he lays that layer on top of it and just synthesizes so much information to put together a customized protocol to help you get well. He's the first practitioner that I personally have worked with. And I know there are others out there that are like you, Guillermo, but I was stuck in Nashville where I think there might be one. And that I had a bad experience with that one myself. That's a story not for your show. But here in Austin, I've got a great practitioner or great doctor that I work with, but they're in and out, man. I had 15 to 30 minutes in my sessions with them. Ryan's taken a lot of time and was able to really introduce me to a lot of these protocols that are helping me get well at a deeper level. But, I'm learning from him. I'm passing on everything that I know, to the Healing Rosie community because I want other women to know, but I don't get Ryan very much. I get a session with him in the beginning. If I have something substantial come up that I have a question about, or I'm like, this is alarming, I need to tell Ryan, I will tell him and he will get back to me within a week. But he is not a doctor on call. He has so many patients. I own it. And that's really what I want my sisters to do. I want them to step up and own it.
And this vision that you have, of like this triage center where people can compare notes and, it's worked in the past. A lot of companies have FAQs and like if you're writing code and you want to compare code or like if your iPhone is not doing something, before you call the Genius Bar, you go to the website and then.
Exactly, right? And that's exactly what I'm envisioning. I'm envisioning the first line of defense not being, I need to go to my doctor. The first line of defense is, I'm going to check in with my sisters, And in this community, we have doctors and practitioners and amazing people who are so excited to help and contribute and lift the boats. It's not a community isolated from doctors, but it's a community where it's like we can synthesize this information. I know, like, Guillermo, I don't know more than you. Okay. I don't. But you put my knowledge of what's happening in my body up against those early doctors. I know more about what's going on in my body than they do.
You know more about what's going on in your body than anyone else in the world.
Well, to a degree, you could even say that to a point. But like from a scientific perspective, understanding, I know because I made it my job. I figured it out, and I also am going deeper into the areas that are affecting me than even a lot of conventionally trained doctors are. And by no means am I putting myself on any pedestal. I love the whole like hold no head above thine own. I live by that. Um, no one is better than me. I am better than no one. I take everyone's advice under advisement. That's how I feel about it. You're going to tell me something that you think I should do. I will take it under advisement. At the end of the day, I totally have tuned into my own gut and intuition about what's right for me. And I think everyone should do that. You know, I think all women especially should tune into their gut, because how many times I've talked to women on this journey who've heard things from their doctor that just didn't sit right or didn't seem right, and they ignored that signal because they had deferred their power over to the doctor. And in no way am I diminishing. Listen, I mean, I'm getting well right now because I have amazing practitioners and doctors that are supporting me and helping me, but I have not turned my power over to any of them.
In this system, where the cream rises to the top, maybe someone says, "Oh, you know what? I tried echinacea, and my nodules in my thyroid went away." And then people are like, start trying it, and then they start saying, "You know what? It didn't work for me. It didn't work for me, and didn't work for me." And then maybe that's not what people are gonna use. And then someone says, "Oh, I had EBV treatment, and my nodules went away." And then they're like, "Oh, I did it too, and it worked. I did it too, and it worked." So now you're creating like this database of information that is going to help practitioners investigate and have like leads. So I think that's amazing. So we're nearing like an hour. So can you talk about Healing Rosie?
Yeah, I would love to talk about Healing Rosie. So Healing Rosie is a brand new brand that I'm launching to help women heal together. I've talked a little bit about what I want to do with this community in this space. We are launching Healing Rosie with an online summit called Flabby, Foggy, and Fatigued: The Fix for Female Hormones. The summit launches October 1st. I'm super excited. I have interviewed 35 of the top practitioners in the world around women's hormones, of course. The hormone issue, hormones are kind of a tell for other things being off in the body. So we broaden this conversation beyond just the hormone conversation. And we talk a lot about gut health. We talk about heavy metals. We talk about trauma, a couple of talks actually about trauma. One of the things that is so important when you're getting healthy is paying attention to your stressors. So we have internal stressors, and we've touched on some of those. I'm sure you talk about that a lot on your show. But there's also all the external stressors, and how many of us have stress in our relationships, stress in our sex lives. So we actually have people on talking about those kinds of stressors, because if we want to be healthy, we have to deal with it all, So I'm super thrilled that this has all come together, and I'm basically creating space for us to have conversations about what's really going on and how we can heal. I'm excited to engage with all the people that are signing up to be part of this event. We are on track for 70,000 plus women participating, and that's super awesome. I love that for sisters everywhere, that they're going to get access to this information and also get access to this community that we're building and participate. I want to hear what people are struggling with and what these women have to say, and continue to find ways to help support them on their journeys. And then on the other side of this summit launch, we've got a Facebook group, and I am going to be doing a Heal Your Hormones boot camp, where basically we take a lot of the information that we learned in this summit and we go deeper with all of it together, and bring our speakers in for Ask Me Anythings. And Guillermo, I'm excited about getting you involved with that, and playing a really important role in supporting these women as they're navigating their own healing journey and figuring out what they're going to do to take their life back.
And so if you're listening, you don't have to try to figure out what the websites are. Everything is going to be in the show notes. Everything will be on my Facebook post about this podcast. Everything is going on my Instagram post about this podcast. So you don't have to go on the side of the road and then try to find a
digging around
for a pen. But can you give me your handles, what the websites are, and what the Facebook group is?
Sure. So if you just do a search on Facebook for Healing Rosie, you'll find us.
And that's like Rosie the Riveter.
Rosie the Riveter. That's exactly who it is. I actually have a story about how Healing Rosie came about. I'll give you the really short version because I know we're running out of time here. But in 1933, my great-grandfather died of double pneumonia. He had a wife and 6 kids. He ran a furrier in downtown Columbus, Ohio. And when he passed away, all of the members of the community, it was a very affluent community that he was in, obviously a furrier, you think of who the clients are for that. when he passed away, the men and women in the community, the couples, the families, came up to my grandmother. Her name was Tina May, great grandmother, and they said, "Hey, I'll take Florence. I'll take Martha." They wanted to pick the kids off because that's what they did. The kids were orphaned. There's no way that Tina May is going to be able to provide for 6 kids. Back in those days, this was before women's lib. Women did not work, outside of the home. They did not have a way to provide. The provider in the family had died. And so the community wanted to make sure these kids didn't just like die, shrivel up and have nothing. And Tina May, basically pulled herself up by her bootstraps. She went to the man who had been helping her husband run the store and asked him to stay on, and she took over the family business. In 1933, this was going headlong into the Great Depression. My great-grandmother took it over, a single mother, going into the Great Depression, running a business. She raised all 6 kids. They all went to college or into the military and married off into families of their own. And I am so inspired by her story. Now, in my family, this is like no big deal. In fact, if my family members were listening to this right now, they'd probably be like, wow, you're telling the story that way? Because we all know that this happened, and it's just like something that happens. He'll pass me the green beans, but it's a remarkable, remarkable story. When you look at this in the context of history, I come from this lineage of women who have had careers even before women's liberation. My great aunt tells this funny story of her husband being in Germany during World War II, fighting the Germans, obviously, and this is when Rosie the Riveter was calling all the women up to work in the factories. And so she was one of the first women to go work in the factories. And her husband was appalled, like, you are bringing shame on the family. How dare you do this? And from her perspective, she's like, my mother ran a business. This is in the 40s, y'all. This is before all of the 60s bra burning. Okay. This was before its time. So this is my family and the women that I come from. And I feel very inspired by women who have that attitude of, call us up, you can count on us, we can do it all. But that's the very thing that's making us sick and breaking us down, because we don't manage our stress well. We don't manage our self-care well, and it causes a lot of things to break down. So we want to heal that woman. That's where Healing Rosie comes from.
That's awesome. So what's your website?
HealingRosie.com is the website. And you can find me on Facebook or Instagram at Tell Misty. The summit site is fixedforfemalehormones.com.
Awesome. And for anyone listening that sign ups for the summit, we're going to be, I'll be doing a couple of Q&As, hopefully with Misty in the near future.
Yeah, we'll do some Ask Me Anything. That's going to be awesome.
That's going to be great. And just bring it. I'm ready. I'm ready for you guys.
That's right. Going to be fantastic.
Misty, I know this was super last minute, and we can totally talk for 6 hours.
I know. This is fabulous. Thank you so much for making time. I'm so appreciative.
So let's do this. You're going to have that program to help people with their hormones, okay? Let's wait until that program is over. Let's start banking some questions. And
Perfect.
Then I'll have you back in a couple of months, and we'll ask those questions, or we'll continue with the second half of your story, and then what the outcomes of this community and how we you are going to help so many women.
Well, I'm really grateful. Thank you for taking the time to fit something like this in and being such a powerful ally for women. I so appreciate. I remember you pulling me aside at Mindshare, just taking so much interest in my story. And I can tell you, being in this space for a really long time, that's uncommon, because it's very tedious going after a lot of these issues. And I know that I'm not alone. I know that's just your way of being in the world and how you show up. And I love that for women. I love that you are an option for women to reach out to help get better. And I know you really can deliver on that promise. And it makes me really proud to know you.
On the flip, calling all women, it's 70%
Right.
of this health space, is you. And because I'm a guy and it's easy for me to say, I'll be a doctor, and sign up and move across the country and go to school. We need more female practitioners, and it's funny because within my profession, most practitioners are women, but it's the same thing. You go to the American Association of Naturopathic Physicians, and most of the people, giving the lectures are guys, which is baffling, So, if you are a woman in this movement and you're looking, maybe it's your time and you want to have a place, a forum, you've never been asked to go on a podcast or whatever, send me an email. I'll have you on my podcast. I'll give you a soapbox.
And one thing I will say, the amazing thing about community is that community only works when people are engaged, and we need practitioners and coaches and doctors to engage with the women who are part of the Healing Rosie community. And, there's definitely a space for any practitioner that cares about this plight and wants to get involved to come and make a contribution. And I've already gotten beautiful notes from people that I don't know that have heard that I'm doing this event, that are raising their hands saying, me, I want to be a part of what you're doing. I have a message for women. I want to help women. I care about what's going on with women, and I want to contribute. And that's really beautiful and inspiring. I feel honored to hold such a holy space and to allow other people to come in and all contribute to helping us get well.
Awesome. Well, thank you so much, Misty, and I'll have you on the show pretty soon.
Awesome. Thank you, Guillermo.
Talk to you soon.